many healthcare workers have been exposed, and if they were on some of these treatments, that may be more effective in preventing infection than some of the personal protective devices have been. I'm Dr. Robert Bransfield. I'm a psychiatrist in Red Bank, New Jersey, and this is my second opinion. I'm a psychiatrist, but I'm working in an area where at first I treated a fair number of AIDS patients, and then Lyme patients, and then patients with PANS or PANDAS. And these are mental illnesses caused by infectious diseases. And now I'm seeing that occur with COVID-19, that some of these people that recover end up with psychiatric and cognitive and neurological residual. And we see that for many infections. We saw it in the pandemic in 1918 and encephalitis, lethargica, and many other infections. And I've written journal articles about that. I work particularly with psychoimmunology because that's a bridge between infectious disease and psychiatry. Someone gets an infection, it impacts their immune system, and that's one of several paths that then can result in neurological dysfunction, causing mental illnesses, cognitive impairments, neurological impairments. And we can manage this epidemic, this pandemic, by prophylactic treatments of high-risk patients. And there is evidence that preventative treatment can work. In Minnesota, there's a study. In South Dakota and Kentucky, they're looking at prophylactic pre-exposure or recent exposure treatment. Many healthcare workers have been exposed, and if they were on some of these treatments, that may be more effective in preventing infection than some of the personal protective devices have been. I treat a lot of people with infectious diseases and immune diseases, and these people are on various meds, and many of these patients are in the middle of communities and families where everyone's sick and they're not. And the meds that they're on are preventing them from getting infected. And we need to learn from that. We need to listen to community doctors and what they observe. And that is really what gives us the information here.